Hey everyone, we're just about to get started. I'm super excited to have you here today. This is my first solo webinar and we're gonna be live. So no matter what happens, you'll be here with me, unedited, we're just gonna wing it. So today we're gonna be talking about orthodontics, GP Orthodontics specifically. The title is StraightSelling Orthodontics in a GP Practice. It's gonna be a really high level presentation today. Any of these topics we can totally dig into. So I do encourage you, let's see if we can get this to go. I do encourage you to go ahead and use the polling option at the top and use the Q&A option at the top to ask your questions. We will cover any questions at the end, but I'd love it if you could submit your questions ahead of time. So that way we don't have that kind of awkward pause at the end. So if I don't have any questions, I'll just jump right off. But you can submit them anytime. I won't even look at them till the end. So see down at the bottom, you can kind of wake your screen up. It says Q&A. We will not be using the chat function. So if you leave a chat, we will not check it, okay? I don't have anyone moderating this, so it's gonna be a little tricky. So just the Q&A, and then there's a poll in there too. I'd love it if you could use it. All right, how come this does not wanna go? That's all right, we'll just do this. All right, anyways, most of you probably know me. My name's Amanda. I'm an orthodontist. I'm the president of StraightSmile Solutions. It's an orthodontic consulting company for dentists. I consult with any dentist, dental companies, dental industry professionals. But for the most part, most of my clientele is pediatric dentists and general dentists. But I'm here to help you be more efficient. We don't collaborate with any specific system only. We help support doctors with every system that's out there. It doesn't matter what it is. So this is me, this is my family, and this is who we are. So make sure you jump on our website, straightsmilesolutions.com/media, to see what other webinars we're going to be doing, because we're going to be doing a ton of really cool ones. You won't have to see me solo, hopefully, too much in the future. The next one I'm going to be doing with Dr. John Julian. He is amazing. If you've never heard him speak, I'm super honored that he's going to be on our show. And he's going to be talking about CBCTs in orthodontics. And when I first saw his presentation, I was super blown away. I was like, I have to have this guy, because I can't believe how much I was missing. It's like operating in the dark, right? You have no idea until you see a CBCT. You have no idea what you don't know. So we're also gonna have Mr. Luis Rivera. He's amazing. He's with Prosper Dental Products. He's gonna tell us a little bit more about CBCTs. We don't want you to be scared about them, because some people think they're super expensive and they're really not necessarily. So let's go ahead and proceed. Yay, now my clicker's working. Okay. So before we begin, I want to make sure that you know how to get a hold of me, how to ask questions after the show. Please do go to my website, straightsmilesolutions.com. I want to show you a couple of new features that are on there that maybe you didn't know about. If you go to the homepage, and this is this, I'm going to start with number 1. If you see number 1 up there, there is a button for a free 20-minute consultation. Now, we're not going to be going over any cases in that. We're just going to be talking about your practice, how we can optimize it, finding ways to be more efficient, just talking about different orthodontic systems. You can utilize that 20-minute consultation however you want. I offer every dentist in the world. I know that's a big, big stretch. And dental labs too, a free 20-minute consultation. Just jump on there and you can schedule it. It's super easy, no need email. Number 2, if you're interested in being a subscriber, our prices are actually really low. So I've been told I purposely keep them low. I have not raised them at all, because I want to be able to service people in underserved countries, dentists there. I want it to be reasonable and affordable for everybody. So that's my goal. We have things as little as like 1 session. We can go over like 1 case, or you can have an unlimited subscription. Listen, if you're just doing like 1 case every 3 months, it pretty much covers it. But we help you with, depending on your level of service, pretty much everything that you need help on. So you probably don't know that you need help until we find out what you can do that you need help. So definitely sign up today. We do take only a limited amount of concierge doctors at a time. I'm not going to tell you how many. I do have a few other orthodontists that do work with me if I need to have additional help. But right now, I will try to be your assigned concierge provider, but it is limited. So I would highly recommend that you start there. Do visit our FAQ session if you have any questions. Okay, number 3, bottom left, it's a little camera. And this is called SmileSnap. So SmileSnap is a virtual consultation tool. Listen, I'm not seeing patients, but they were super cool and they let me use it for a few months so you guys can play with it. So I installed it. It was so easy. The code just drops right in. Installed it on my computer. You can go ahead and play with it. You can change the verbiage. So I was kind of using it if you guys want to communicate with me about a case, but you can use it in your own way. So you should totally check it out. For now, feel free to play with it and just do whatever. And then on the other end, there's a dashboard. So theoretically, I can probably show it to you if you want to do a screen share. But anyways, they'll be glad to do a demo. If you want an introduction, let me know. All right. And lastly, number 4, you may not be able to see that up in the top right, there's a portal. This is our HIPAA compliant portal. If you are a client, you'll have access to this. Every client gets access to their own HIPAA compliant portal. That's how we submit our cases. If you want really fast responsiveness, we have a couple other ways, but there's about 30 different ways that we can use to communicate. So we'll find the right way for you, and we'll go over all the options with you, okay? And then don't forget, we are launching our digital education series, not only digital, but we have like hands-on like destination where you can go someplace and learn. We have hands-on, you can do it on your own time, digital, but you will get actually a physical kit that you can learn to practice different types of orthodontic movements and education. This is totally customized for you. This is new. We literally launched this officially last week, but you can go to our website if you want information. It's because it's customized, the price point's also customized. So if you're interested, let me know what part you're interested in, and I'll go ahead and send you that information. I did promise you, I forgot to mention this, but I will mention it in your follow-up, that every one of you who's actually on the webinar today, and I have a list of your names and your practices, if you follow up with me, by the end of the week, I will give all of you something free. So the something free will be different depending on who you are. If you're an existing client, if you're a new client, what type of systems you use. So I'm not going to be specific, but the value will be somewhere between $200 and $500. You're something free. So you do need to email me to redeem it. If you're an existing client and you're not interested in the something free, or you're a vendor and you want to gift it to somebody else, just let me know. Just introduce me to that person. I will gift the something free to them. Okay. All right. Enough of all that. Let's go ahead and begin. We're going to head and start a little bit about what is GP Orthodontics, what's the story behind it, why am I interested in it, and basically, in a nutshell, my husband's a general dentist, and he bugged me for many, many years to let me teach him a little bit more about GP Orthodontics and how to do it successfully. We hear all these stories and see cases about unsuccessful attempts, but very few people are doing it, A, successfully, and B, efficiently, and C, productively. And that's kind of the triad that I help my clients do. So his goal, ultimately, you know, and it was a good goal, was to try to offer lower cost options for his patients that weren't necessarily comprehensive, but that were problem focused, like uprighting a molar or just doing some alignment so he could do better cosmetic work. So I think he had a great argument. So I started advising him and his friends, and it kind of grew from there. So that's how this company got started a couple years ago. What are the pain points? So I hear a lot of pain points often with GP Ortho. So let me go over what they are. Hang on, I get to have a break too. Okay. So pain points, number 1, cost. Everyone's freaking out. They think it's super expensive. Our digital series is like hands down the cheapest way for you to get trained, at least in straight wire. There's nothing else like it in the world. I can honestly say that because I checked them all out. It's crazy cheap. I keep it, like I said, I keep it cheap for a reason. I want it to be affordable. I want you to be able to do it on your own time. I want there to be an accountability loop for your teams. So make sure you reach out to us. But regardless, we have tons of information that we can teach you just on our YouTube sites. We've got hundreds of videos, and you can learn just about everything. But it does not have to be expensive, and we'll kind of go over a couple of things. Number 2, a lot of people are concerned about upsetting their existing referral base. And a lot of people have friends that are orthodontists, and they're afraid it's going to cause trouble, and that's not going to happen at all. As a matter of fact, the doctors I've worked with, none of them has not sent a lot of referrals, because what we're going to do is we're going to teach you about where that line is, where you should refer and where you shouldn't refer. And that line is going to be different depending on the doctor. Your skill set, your knowledge base, everything like that. We'll help find that line and we'll set it. So you're going to be screening so many more patients that literally you're going to be referring so many more patients. And I always get some nasty email after I do a presentation from some orthodontist saying, "What? You're ruining our profession." And that's not the goal at all. As a matter of fact, I'm telling you, we will send you more clients. I'm not saying they're going to be easy ones, but you're the specialist, you know? Hey, oral surgeons, they get the hard extractions. Periodontists, they get the hard surgeries. It was easy. The GPs would take it, right? So that's just how it is. Number 3, this is a big one, inefficiency in margins. A lot of people are like, hey, I'm already doing Invisalign. I'm already doing ClearCorrect. I'm already doing 6-month smiles. It's going fine. I did 20 cases last year. Okay, that's great. And I'm super happy for you. But let's dig into that a little bit more. Let's actually go look at your margins. Let's see how much you're actually making on each case. And I'll dig into it if you let me in. I will dig into it and I'll find the little holes where we can do things better. And hopefully you can make a lot more money on each case, and or lower your price to make it more affordable for a different kind of patient base. So it's always great to have a good, better, best model. So we can talk about that. Remember, I do offer a complimentary consultation for every doctor. Okay, here's another thing that I see general dentists maybe not doing ideally. They're only offering one system. Like, I only offer indirect bonding, or I only offer aligners, but nothing else. You need to offer all three buckets. If you do not offer all three buckets, you are missing out on so much low-hanging fruit. It's not even funny. Also, sometimes it can be a little bit of a liability, because maybe you're starting a case in aligners and maybe it's not an optimal case for aligners, and maybe you're having trouble finishing it. And it'd be so much better to switch it over to a braces case. I work with doctors all the time to create forms and paperwork so that it's really easy to have a lateral transition between different appliance systems if they need to, either due to compliance, patient preference, biomechanics, whatever, so that it's not a big deal. And you shouldn't be afraid, because it's really not as hard as you think, as long as you're picking the right cases. And we'll kind of go over that a little bit, how that works. And you can see so many more patients, and you're doing a great service for your community, access to care, all that. Okay, so these are some dental and orthodontic conditions. This is, by the way, I have all this kind of stuff if you want it. I have it in a PDF. So if you want to upload it to your Open Dental or something, this is kind of my checklist that I recommend that you go over on every patient. I know that sounds like a lot of work, but you can do it afterwards. Have your team take photos, and we talked about this in the last webinar 2 weeks ago with Bill Moore. Take photos and start screening them for opportunities. And over time, the value of these photos, you know, it doesn't have to be just for orthodontics, increases, because it becomes extraordinarily powerful to be able to monitor a condition over time. Like, hey, Mrs. Smith, look, we took photos the last couple of times you're in. Look, your crowding is becoming more progressive. Or, hey, Mrs. Smith, look, I see you're having more gingival impingement from your overbite. Let's go ahead and talk about our options. So it's amazing. And the studies show, and I have to reference Bill Moore with this last week at our conference, at our meeting. He did, this is his stats, but his stats are people on average go from a 35% case acceptance rate on big cases, you know, on big production, to a 90, 85 or 90% on big cases with just a couple, you know, years worth of dental photography that you can reference at every appointment. So highly recommend it. You can talk to Bill if you want to about how to implement that. It's a very small cost. You already have all the systems in place. Let me know if you have any questions. Okay, so we talked about the three buckets. We're gonna go ahead and dive into appliances. I call this phase one. There's a zillion different systems. Like I said, I have no preferential system. What you wanna use is what I wanna use. If you have no idea what you wanna use, I'll tell you some options. We'll help to find the lowest price point for each case. Our goal is for you to increase access to care, quality of care to your patients. I do strongly believe in phase one and early treatment, intervention treatment, airway, and all that. I always have. A big fan of it. Why? Because, you know, I'd see patients in my office that were teenagers and they've already finished growing, and we had to do jaw surgeries or really give them kind of less than optimal results because we had to do compromised kind of treatment like pulling teeth. Listen, I know there's research all different ways and nothing's set yet, but I saw the trends a long time ago between extraction cases and airway issues. That's just my opinion, okay? So that's the last thing I want to do for a patient. I try to avoid it as much possible. If you want to do it, that's great. I'll teach you how to do it. But ultimately, you need to explain the risk, benefits, and alternatives to every patient. But if you start early, no need. You don't need to do any of that. I mean, 99 times out of 100, if you do phase one treatment and you do it right, you don't need to do all this kind of stuff. They're not going to need, you know, extractions. They're not going to need jaw surgery. 99 times out of 100, there's an occasional one-off that you just can't control. But at the very least, you can make it less severe. And maybe they don't need it, you know, need it to be functional. So this is just some of the billing codes. This is how I advise it, the difference between phase one, phase two. This is a whole nother lecture. I'm going to be doing this in the future. I'm just kind of getting my ducks in the row with who wants to be on that lecture. But so many options, so many different appliances. I can teach you how to use any of them. You tell me what you want to learn. Some of them you have to go through a certification program. Their prices are a little bit more. Some of them can be purchased at your local orthodontic lab. I can introduce you to some of my favorites that are out there. We can go over price points, but you can do so much with these patients with phase one. So get excited. Let's do it. Okay, what about braces? I know you're all kind of freaking out. Some of you are doing maybe like fast braces or 6-month smiles, and that's fantastic. Good for you. I think I'm not familiar with the fast braces course because they didn't let me in, but I am familiar with the 6-month smiles course. I've sent many people to it. I also have my own course, a little cheaper. And we also are going to have like an actual destination course. It's going to be in Phoenix starting in November. I don't have all the details yet. We're still figuring out the pricing and who's collaborating, but we're going to have a pediatric dentist on the team and 2 orthodontists. It's going to be a destination lecture. You're going to be able to do hands-on everything. It's going to be so incredibly cool. There's nothing like it out there. And we're going to try to keep the price point reasonable as well. But anyways, yes, you should do some type of braces. Of course, I'm a big fan of indirect bonding. Plenty of different places you can get it. Right now, the cheapest price I can tell you that I can get is $360 for upper and lower trays with the brackets in it. It looks like this. Okay, well, these are clear. Clear's, I think, a little bit more porcelain. But, I mean, that's really reasonable. I mean, literally, the computer tells you where to put the brackets. You don't even do it, and you just approve it. And you slap it on. I mean, I know it's not quite that easy, but there's tons of videos out there. If you can do a composite, you can totally do indirect bonding. So you don't really need to know where to put a bracket because the bracket is already placed digitally for you. You just slap it on and like here, peel it off, put the wire in, and I can teach you all about wire sequence, how to tie in. I have all that material already. I can give you the kits, hands-on. You can learn everything ahead of time. We can have you up and going in just a few weeks. So definitely let me know. This is what it looks like up close. I mean, there's all different ways, so it may not look exactly like this. By the way, this is compliments of Ortho Select. Thank you, Stephen Gardner, for sharing this with me. I have a lot of cool pictures that have been shared. Aligners. Like I said, I'm a big fan of aligners, not particularly affiliated with any direct brand. There's tons of brands out there. You want to do Invisalign? Great. You want to do ClearCorrect? Great. You want to do an off-label aligner? Great. You want a 3D print? Great. So I'm glad to introduce you to tons of options that are out there. We can get your price point crazy cheap. And you'd be surprised if you want to set up your own in-house lab. It's not my recommendation to jump full force into it. I think you should start off, with regular aligners first, understand how it works, and then set that part up because there's a lot of moving parts with that. But we can get you on one of the other clear aligner options. If you don't want to use a branded one, you want cheaper prices, they work just as well. For the average case, maybe not like a crazy case, but an average case. And I can help let you know which ones you can pick. This is a little bit about how things have changed in the orthodontic industry. Glad to show you a little bit more, but in the last generation, this is kind of my infographic about how now a big chunk, at least in the US, of orthodontics is being done by general dentists. So we need to back you guys up. We do, because you know what? You're doing it anyway. So we might as well back you up. We might as well help support you. Just an off note, I had a great conversation with Invisalign in the last couple of weeks, Joe Hogan, some of the other team members, and they were telling me about their Invisalign Go model. It's pretty cool. I have to give them credit. I'm writing a blog post at their request on it, but they are really supporting the interactive kind of interdisciplinary options having to do with orthodontics, and you really should look into it if you aren't already. Clear aligner basics. Thank you to Full Contour for providing these slides. Real quick, lots of basic stuff you should know about clear aligners. You're going to learn a lot of this in some of the courses, but you don't have to take a course. I mean, I don't think you need to take a course. It's really not that hard. Attachments move teeth. You do need attachments for certain type of movements if you want it to be efficient. Of course, we know there's a huge DTC aligner industry, but they're doing simple movements and they're staging it slightly differently, and that's why they can do that. So no, you don't always need attachments, and I think that's something we're all brainwashed to think that it's required. And no, you really don't need optimized attachments for certain kinds of movements. Again, brainwashing, but that's just my opinion. These are Full Contours guidelines. They're a design company, big fan of them. They're super nice. Let me know if you want an intro. This is a little bit about interproximal reduction. We do have an interproximal reduction course. It's part of our digital package. If you'd like to take it, let me know. But we can teach you all about it. I have tons of options that you can use and be glad to introduce you. But yeah, sometimes IPR is needed. You really need to understand why you use IPR and why you don't, because when you get a treatment plan from a branded aligner company, you shouldn't go with what they say just because they say it. I mean, this is just a technician. It's not an orthodontist. And they may have orthodontists on their team, but doesn't mean they're taking a look at your case. You need to understand why you would want to move the teeth forward, why you'd want to pull them back, why you want to expand an arch. And if you don't understand, a lot of crazy side effects can happen if you're pushing teeth forward or out. And if you don't understand that, I'd be glad to explain it to you a little bit more. But then again, you don't always want to do IPR either. So there's pros and cons to everything, and every case is different. You can't have a global approach to this. So again, if you have any questions, I'll be glad to explain it to you. Thank you to Bayshore Studio. ClearFit for providing this graphic. But anyways, these are the two, number one and number two aligner products out there, just a little bit about how they work, different types of classes they have, their price points. These are the ranges. Whether retention is included or not, you have to compare apples to apples when you're picking an aligner product. So, and really understand what you're using. Do you have a scanner? Are you planning to get a scanner? So many things to think about, support, etc. This is my graphic a little bit, and I think this is where a lot of GPs get confused. A lot of GPs have troubles with their cases. Something's not going right? And they're like, I don't know what's going on. There's 4 moving parts in an aligner case, and you need to understand the moving parts, and you need to understand your relationship to the moving parts, and you need to understand your responsibility. And I think a lot of times we're like thinking that other people are handling the different moving parts, and ultimately it's your responsibility, and you have to understand it. So let's go ahead and take these each in sequential order. Number 1, case selection. Case selection is huge. Here's some examples of my good cases, not so good cases for aligners. You can't judge a book by its cover. It might look difficult, but unless you're an orthodontist, you may not know. So you need to really get trained up. You're gonna submit a case, I'd say, to the number 1, the number 2 brands, and they pretty much don't turn anything down. They'll take it all. They'll say, yeah, we can do it, no problem. Hey, that's great, I love that. But is it really predictable? Is it really a good case for that system? That's where you as a general dentist may not know. Just because they say yeah doesn't mean it's predictable. Just because they said yeah doesn't mean that it's healthy. Doesn't mean, I can keep going. So number 2, the design of the treatment plan. When you get a treatment plan back, there's preferences and they'll go ahead and help you optimize it. But you can't just use global preferences for each case. Each treatment plan has to be custom created. And remember, this is just a technician. You may have a really great technician or a really junky technician. I can tell you by looking at the plan, I see great things come back and I see just awful things come back that make me cringe. And it's hit or miss. And until you understand what's good and what's not and what's predictable, you really need someone to help you. So I highly recommend that you give us a call about that. Production. If you're using one of these companies, production's great. I don't really have any problems there. But if you're using an off-label company, production is a big deal. You need to know what kind of thermoplastic material they're using. You can't compare apples to apples unless you know they all have different properties. I'm pretty familiar with most of them, so feel free to ask me. I have my preferences, of course, but there's a lot. There's at least, since Invisalign's first set of patents were up last fall, there's at least 50 different options in the US alone, and that's not even including DTC. Globally, oh my goodness, I can't even keep track of it. It's just too much. There's too many options. Some probably won't live, some will die, It's not just price you should be looking at. There's a whole bunch of different features. Please, before you jump into a new product, ask me. I'm glad to help you free of charge, just to give you advice. And of course, this is the part that most general dentists, this is the part that they mess up the most, okay, which is compliance. And by compliance, I'm talking about tracking. It blows my mind how people will take a course, and they will come out not understanding the concept of tracking. I don't get it, because this is actually the most important part of the whole course. Forget everything else, it's just fluff. You need to understand tracking, and this is not necessarily the best example, but you can see the arrows pointing to where a case is not tracking. If a case stops tracking, it's not gonna turn out. You're definitely going to need a refinement or a revision. Those are expensive, and guess what? I did a little poll at an event I went to with orthodontists last month, and those orthodontists only had an 8% refinement revision rate. What is yours? Remember, we talked about profits and margins. If you're having to do more than 15, 20% of your cases with revisions, refinements, mid-course corrections, you're doing it wrong. And the number one thing that you're doing is you don't have an accountability loop with your patients. You don't have a check-in system. There are branded check-in systems that are out there that you can use. Of course, one of them is DM, dental monitoring. I'm a big fan. I'm glad to introduce you to them. But you can create your own too. I know a lot of people that have gotten creative and figured out HIPAA compliant ways to check in with their patients. Of course, if you're doing a huge volume, that's gonna be a pain. But this is gonna save you a ton of chair time and revisions, refinements, and it'll help to increase your profit margins, and it's gonna make you less frustrated. Patients are gonna have a better experience. They're gonna be sharing it. Of course, make sure you get photo releases on everything because you wanna share all your awesome results, et cetera, et cetera, et cetera. Anyways. So that's pretty much our whole lecture. I told you I'd blast through it pretty fast. Just a quick reminder, we are not doing CE units. We tried to keep this free. If we offer CE units, we have to charge you for the webinars because it's really expensive and we're a small operation and I want to make it really free and available to everybody. So don't freak out if you don't get a CE certificate. We will be offering CE units at our course, our destination course, the one in Phoenix this fall. We will be offering that, okay? But there's a cost for that one. So in any case, there's our website if you have any additional questions, if you want to schedule that complimentary consultation, if you want to redeem your freebie, your gift, your customized gift, make sure you email us at the bottom, mention your gift or mention that you're on the webinar and we will schedule a conversation and we'll figure out how we can help you and give you that gift. All right, anyways, that's pretty much it. Don't forget, if you haven't used your Q&A, throw your Q&As up there right now because I'm going to go ahead and see if there's any. And then, not yet. I do not see any. Let's see. Q&A. Okay, make sure you use the Q&A section. I have no open questions right now, so I'm going to answer a couple that I got previously, and if any of you want to ask live questions, please do ask them. Otherwise, we'll jump off and we'll end the conference. And this will be available later on YouTube. We'll post it. Hopefully, it did record. And yeah, so main questions I get, I mean, a lot of people are just confused. They want to know what systems to use, and that's a really challenging question. It's just, I don't just have one system that I say, use this. You know, I need to learn a little bit about your patient base, your demographics, your philosophy, what you're using, what you like, what you don't like, what type of general dentistry you're doing, and then we'll kind of dig into it a little bit more, maybe how trained your team is, what they're interested in. Remember, this is their process too, and they need to be a part of this process. So make sure you include them in this, and our concierge package does include team support and team training. They are part of all this. I want them to be excited about it. So that's my main question. Any other questions, make sure you put them up now. Otherwise, I'm going to jump off. All right, none. All right, well, have a great day then, everyone. And oh, wait, hey. You rock. Okay, thank you. I know this doctor, he's so awesome. All right. I think you meant IPR, not IDR. For the IPR, how do you, IDB. For the IDB, how do you replace missing brackets? This is an awesome question. Thanks. Yes, it's actually really easy. So you know what? Thanks for asking that. I'm going to go back to our presentation. It's going to let me, and I'm going to show you how you do that. Super good question. See, I love it when I get questions. Okay. So I have to give credit to my friends at Ortho Select for coming up with this. I mean, we kind of troubleshooted this together way back in the day. So you see the tray there, okay? So what you're gonna do is you're gonna keep the tray, okay? Now they're gonna send you one set of brackets within the tray, but it is recommended that maybe you try to get a backup set somewhere. I mean, you can consider asking for a backup set, maybe from the lab if you're not ordering your own, just to have. But most of the times when patients lose brackets, they come back holding it. You can just ask them to hold it. They don't usually swallow it. But you just go ahead and section the matrix at that tooth. So just like you have like, let's say, I don't know, sometimes you have like a bridge or you have a matrix to make a crown, a temporary crown, right? And you save the matrix, same thing. So if you need to redo it, you save it, you section out, let's say you section out tooth number 30 there. Just section that, because everything else has moved, right? So it's not gonna fit anymore unless it's like a week or two later. And then you go ahead and plop the bracket back in, go ahead and etch, prime, and bond, slap it back on, really easy. And, you know, I always recommend that you do take a picture of the patient at the bonding appointment, because you can also see how the bracket placement was. Of course, you want your right bracket to match your left bracket, right? But we can help to make sure your bracket position is idealized. But I do recommend, honestly, for every ortho case that you take pictures every visit, and I know this doctor does, but you know, that's really important. Fantastic question. Thank you. All right. Any other questions? Last chance. All right. Fantastic. Have a fantastic evening. Thank you for being on the meeting. Take care. Oh, wait. Nope, that's it. Bye.